And the cat gets tricky.
Of course.
It does, because mammals are just weird. So there's all the lungs. Here's the heart. Yours is just this big blob, but if you take it off, you can actually see the heart there. So you have a right atrium and a left atrium. You have a right ventricle and a left ventricle. Any of these arteries or veins, what are those going to be?
Coronary.
Coronary, okay.
They're good.
So you're going to have the pulmonary arch and the aortic arch in there. So pulmonary arch is going to be down here. The aortic arch is going to be up there. The precava goes up. Postcava goes back. So, there's two different things. There's a big vein that goes that way. There's a big vein that goes this way. Precava goes up. All right, so it splits. This branch here is the subclavian. So you think about your collarbone sits about right there. Okay, so that's subclavian, underneath the collarbone. This is the innominate. All right, going on the arteries now. This is the innominate. That's the subclavian. So they're switched. So with precava, subclavian, innominate. Now we have subclavian on this side where this is the innominate. And here's the innominate on that side. Okay, so there's the internal carotids. The internal jugular is going to be right next to that. My external jugulars were there, so they're gone, but they would have been there. All right, let's do this side. So for a little bit in here, it's axillary, but if it's all once it's down to there, it's going to be the brachial arteries and veins. Right, you've got a subscapular artery and vein. You can only see the veins here. They're really nice and blue. But there are arteries in there if we find a cat that has them. So brachial goes to the arm. The subscapular goes underneath the scapula, which is right under here. So there it is, going right underneath the scapula. And then you have a transverse scapular artery and vein. Okay, it's going this way across there, and there's the external jugular. So, just for completeness, there it is. There on the outside. All right, heart, lungs. There's the diaphragm, the liver. My gallbladder, I believe, is way down in there. On one of these lobes. Yeah. So the gallbladder is way down in there, but it is there. Right, and it's that little pouch there. So we have the stomach coming down. The greater curvature goes around the outside. The lesser curvature goes in this way. Here's the body of the stomach. Pylorus is going to be up here. So pylorus is going to come this way. Here's going to be the body. You're going to get to the pyloric sphincter, and you're going to get to the duodenum. Right, and once we're there, we've got to start looking for our pancreas, and now it's right there. So again, that fleshy bit, that's the pancreas. That whole big... So if we look at all the rest of this stuff, it looks all spiderwebby and stuff. There it looks all fleshy and meaty. And I know everybody expects the pancreas to be something like an organ, but it's just that. However, it's very not good when something goes wrong with it. Well, that and pancreatic cancer isn't exactly the best cancer to have either. That's the spleen. There's a kidney. Close that. Here's the postcava. The dorsal aorta is this kind of faintly reddish guy next to him.
Where?
Okay. That's all dorsal aorta. Vein going to the kidney. What's that?
Hepatic portal vein. Renal. Oh.
Renal.
Jeez,
Renal.
liver. Sorry,
Yeah.
everyone.
I'll point this out because it's pretty apparent in this guy. Here's the inferior mesenteric artery. Now I'd have to pull all this stuff back, and it'd be really hard to get at. And there's a bunch of there's supposed to be a bunch of arteries and veins, but in your picture it's all the way back here, so we'd have to dig all this out, and I don't want to do that. There's the iliolumbar artery, and then the vein along with it. All right, here's the external iliac artery. Let's make sure I get this right. All right, here's the common iliac vein. All right, still common iliac vein. You see this first little branch there, that little bit of blue? All right, now in between these two guys, that's going to be the external iliac vein. So after this first branch, so you're coming down here, we've got this split there, and we follow it down. So this is all common iliac vein, first split, external iliac vein. And then once you run to the next one, and we'll probably pin it down there, now you're in the femoral vein. All right? Now in the artery, it's all external iliac artery, and then it's all femoral artery. So there's an extra thing within the veins down there. Greater omentum was all that fatty stuff that was covering all this. Mine's all gone, but it was there. And then here's our large intestine. Following it. So there's a descending, which means it goes that way. There's a transverse, which means it goes across. And there's also an ascending portion of it. So descending goes this way. Transverse goes that way. Ascending goes up. Follow it all the way back to here. All right, that little nub, that's the cecum. That's essentially its appendix there. All right, urinary bladder, right, little sac. These tubes coming off, those are the ureters. They should go up. If I hadn't completely destroyed them all, they would go up all the way to the kidneys. So expect a nicer dissection than this for those. This little bit here that I'm pulling on, that's the ductus deferens. They loop up over the ureters. So you're looking for a loop. If you're looking for the ductus deferens, this is a male. But they're going to loop up and come down and follow down this. So here's one testes. We wouldn't cut it off. That was just, again, my error. So you got the testes, and then this bit here, and I'm going to show the stage move. Do you see the little tubes in there?
Hold on, camera can't focus. It's trying. Oh, yeah.
See the little tubes in there?
Uh-huh.
That's the epididymis.
Epididymis.
All right? So little tubes in there, epididymis.
Good champ.
What do those do?
Yeah, exactly what he said.
What?
They store sperm. Very little of the seminal fluid is produced inside the testicles. They're basically just there to